My father is an only child raised in Houston, and his first cousins grew up in New Orleans. My dad and those cousins, now in their late 80s and 90s, recall wonderful summers together with their grandmother in Kosciuszko, Mississippi. Those are some of my dad's fondest childhood memories, even though the reason that he and his cousins were sent to the country each summer was terrifying. Polio was rampant in cities when the weather got warm, and parents were counseled to get their kids out of town. Yale Medical School explains why. By mid-century, polio had become the nation's most feared disease. And with good reason. It hit without warning. It killed some victims and marked others for life, leaving behind vivid reminders for all to see: wheelchairs, crutches, leg braces, and deformed limbs. Each June in America, like clockwork, came newspaper photos of jam-packed polio wards. The polio rate in the U.S. in the latter half of the 1940s was double what it had been in the first half of that decade. And then it doubled again from 1950 to 1954. The United States had never experienced a higher crest of the epidemiological wave, a journalist noted of the 57,000 reported cases in 1952, and never would again. Then along came Dr. Jonas Salk and his injectable polio vaccine. By 1957, the number of polio cases in the country had declined by nearly 90%. By 1979, nobody in the U.S. was contracting polio except for the tiny number who would ironically and tragically be infected by the more effective live oral vaccine developed by Dr. Albert Sabin. The near eradication of polio was the natural consequence of the development of the wide distribution of the vaccine, even with the risk of ingesting live virus. By contrast, failure to trust the physicians or science more generally, overstating the risk of live virus, would have the natural consequence of increasing infection, polio deaths, and lifelong disabilities among many survivors. What, you may ask, is a natural consequence? Let me explain by comparison. This week, Torah tells us about a logical consequence, as God inflicts Egypt with the first 7 plagues. They are logical consequences imposed by God as a response to Pharaoh's wickedness. Yes, God's intent is to free the Israelites, but not right away. God chooses to harden Pharaoh's heart, causing the king to continue refusing to free the Israelites. Perhaps the king, left to his own devices, might have relented long before the slaying of the firstborn, and that makes God seem more cruel than necessary. As Philip will explain tomorrow morning, God has decided that Pharaoh is so extraordinarily wicked that he should not get off easy. It's logical for God to want to plague the wicked Pharaoh, but Pharaoh's wrongdoing doesn't naturally turn the Nile into blood. By contrast, the polio epidemic is a plague that could return to America as a natural consequence of increasing unwillingness to heed medical advice to vaccinate children, even when required by law, for school registration, for example. The percentage of children not being immunized could skyrocket if states started rolling back school vaccination requirements. Worse, if an activist who puddles insidious lies about vaccines were to become the United States Secretary of Health and Human Services, government recommendations about vaccines could be changed, not because studies show the risk of vaccines to be greater than the benefit, but because of falsehood-fueled ideological choices not to protect oneself and one's children from dread disease. It's hard to imagine that any vaccine would be banned, but several things have happened in the last 4 days that might have been unimaginable last Shabbat. The COVID-19 pandemic was not good for vaccine compliance, and not only because that particular immunization became politicized. The Centers for Disease Control reported from the 2019-2020 to the 2022-23 school year, national kindergarten coverage with from the 2019 to 2020 to the 2023-24 school year, national kindergarten coverage with state-required vaccinations declined from 95% to 93%. The CDC studied rates in 2023-24 and not earlier because the pandemic kept many people home, including away from pediatricians' offices, and fewer children were vaccinated. The National Institutes of Health documented increasing incidence of infectious diseases such as measles and pneumonia, a natural consequence of fewer people being vaccinated during the pandemic. By 2023-24, though, we had reached the new normal, so vaccination rates should have returned to pre-pandemic levels. They did not. No, a decline in the vaccination rate from 95% compliance to 93% does not sound significant, but it was enough to increase death and suffering, and the decline happened before opponents of vaccine mandates held the reins of government. Over a quarter century ago, a group of Reform rabbis appointed to respond to questions of Jewish practice was asked whether a synagogue religious school could require immunization, even of a child whose parents believed that vaccines presented an unacceptable risk. That response, based on our Jewish tradition, was clear and unequivocal, recalling that saving a life overrides virtually every commandment with which it could come into conflict. The rabbis ruled that immunization saves lives and should therefore be mandated. Jews are religiously obligated to pursue healing and good health. Even more, we are forbidden from endangering the health of others, and the rabbis noted that vaccines will not succeed in conferring immunity upon every single person. Our chance of contracting disease is lower, therefore, if those around us remain healthy. That is, if they are immunized, than if they carry the disease. While the rabbis acknowledge that some people, relying on the internet and other sources, believe that vaccines cause more illness than they prevent, the rabbis concluded, we find that the risks that they pose are far outweighed by the prospect of infection, morbidity, and mortality from the diseases they are intended to prevent. For example, each year in the United States, 8 to 10 people will develop paralytic polio as a result of immunization with the oral polio vaccine or through contact with a person who has received that vaccine. That number pales in comparison to the horrific toll that polio took on Americans before the Salk or Sabin vaccines were developed. This Shabbat, we celebrate the bar mitzvah of a young man, and, as is always the case with this particular family, we celebrate the grandfather too. Yes, Fred Levin is humble, but all you have to do to know that he's a great man is to look at the group seated in the front of the sanctuary tonight. Although being pawpaw is now Fred's full-time job, and he excels, he was at least as outstanding as a physician, as a pediatrician. Most people think that a physician's primary job is to heal people who are ill. A pediatrician's most important duty, though, is to prevent illness, and there is no more effective method than universal vaccination. Fred did that holy work across many decades, including for quite a few of our congregants, including our president. Today, our job is to assure that Fred's successors may continue to practice state-of-the-art preventative health care. The beautiful music we're about to hear is a prayer. Livracha v'lo liklala, l'chaim v'lo l'mavet, for blessing and not for curse, for life and not for death. Let America and let each of us continue to choose to be immunized, protecting ourselves and our community. Then may we multiply God's blessings.